Great. Welcome, everyone. Delighted to have you all participate in today's first inception of this mini-series in nephrology, nephropathology. Today's session, the first one of this episode, is on approaching nephrotic syndrome after COVID immunization by Dr. Carmen Avila-Casado and Dr. Sumant Chugh, and moderated by Dr. Vanesa Bijol.
Thank you so much, Ali, for this nice introduction. And I would like to, being this the first of the mini online seminar series organized by the ISN and GLOMCOM as a partnership, I would like to thank very deeply GLOMCOM for fostering us as ISN in order to contribute with our education to these GLOMCOM sessions. Also, I would like to take the opportunity to thank you, all the members of the Renal Pathology Working Group, as well as the education working group from the ISN that make it possible with their contributions in order to prepare this educational partnership seminar series. So I will thank you very much for the opportunity, and I hope we can have a very good presentation and meetings. So the next slide, please, Matt. So going back to our presentation today, so we are going to talk about how to approach nephrotic syndrome after COVID immunization, and I'm going to present what we consider new concepts and insights about podocyte injury or podocytopathies. Next. So the outline of this, I have nothing to disclosure, first of all, and the outline is going to be, we are going to present an index case, and I'm going to present pathology findings and my proposal for the new classification of these podocytopathies. And after that, Dr. Chugh is going to talk about the molecular pathways involved in the development of these diseases, especially after immunization or after viral infection. Next. So going back to our index case, this is an 18-year-old male, previously healthy. He had presented with a sudden onset of edema 4 days after Pfizer COVID-19 vaccination, being previously healthy, but he had a past history of asthma since childhood. The edema that presented 4 days after immunization got worse at day 7 after the onset, and patient was seen at day 12 by the referral nephrologist. Patient has no family history of renal disease. Next. The lab investigations at arrival showed that the patient has hypolipidemia, hyperlipidemia, although details were not disclosed. The patient has a urinary creatinine ratio of 700 milligrams per millimole, so the patient is nephrotic, and the creatinine was 110, and although we don't know the details about the weight, it was considered as high by his primary physician, elevated. At 2 weeks after the onset of the edema, a renal biopsy was performed. Next. And what we found is a very nice core of renal tissue that contained about 30 glomeruli to be analyzed. All the glomeruli show exactly the same change that we are seeing in here, with this mild retraction of the glomerular tuft with prominence of the visceral epithelial cells, very mild prominence. Next. The tubular interstitium is very well preserved, as we can see, and few glomeruli show also that there was some congestion, but the presence of fibrin was not seen. Next. And in particular, regarding the tubules, although the tubular interstitium is very well preserved, we can see that their tubules are full of tubular droplets of protein, as this patient is probably presented with protein overload. Next. The immunofluorescence is completely negative for all kinds of immunoglobulins and complement. Next. And the electron microscopy shows very, very interesting findings. First, as you can see with the blue arrows, there is extensive food process effacement. All the food processes are effaced. And you can see them in the outer aspect of the glomerular basement membrane. The other interesting aspect is the presence of microvillus transformation. due to these food processes are producing hairy extensions of food processes that are projecting to the urinary space. Next. Other interesting finding is the presence and what we classified as endothelial cell hypertrophy, and we can see that in many areas the capillary loops are lacking the normal